Welcome to Learning Science Daily. Today, we'll continue from where we left off in part 1. If you're new to this course, and this is your first video, make sure to subscribe to the channel, so you don't miss future lessons. In this series, we'll dive deep into the advanced concepts of biopharmaceutics and pharmacokinetics. If you're an undergraduate student in pharmacy, these lectures will be extremely beneficial in strengthening your understanding of the subject. In the first video, which is part 1 of chapter 1 of this course, we explored the fundamentals of pharmacokinetics, specifically, what this field of study focuses on. Now, let's move a step further and discuss what clinical pharmacokinetics is. And, more importantly, why is it essential in the practice of pharmacy and medicine? When new drugs are being developed, they are tested on large groups of people during clinical trials. These trials help find out how well the drug works and what the best dose is for most people. The doses recommended after these trials usually work well for the majority of patients. But here's the catch: not everyone responds the same way to a drug. People can react differently due to things like age, weight, genetics, or other health conditions. Because of this, some people might get too little of the drug, which doesn't help them, while others might get too much, which can be harmful or toxic. That's where clinical pharmacokinetics comes in. It's the science of using drug concentration data to help doctors adjust the dose for individual patients. Sometimes, even with advanced science and technology, doctors still need to check the exact level of a drug in a patient's blood. This is especially important in the cases when, 1. A person is taking multiple medications, 2. The drug is very strong or dangerous at higher levels, and 3. The drug has a narrow safe range, meaning the difference between a helpful dose and a harmful one is very small. This process is called therapeutic drug monitoring, or TDM, and it helps make sure the drug is working properly without causing side effects. What is clinical pharmacology? Pharmacology is the science that studies drugs, what they are, how they work, what they do to the body, and how they are used to treat diseases. When we apply all this drug knowledge to real patients in hospitals or during clinical trials, it becomes clinical pharmacology, the use of pharmacology in actual medical practice. Now, what is pharmacogenetics? Pharmacogenetics is the study of how a person's genes affect their response to drugs. Because everyone's genetic makeup is different, the same drug can work well for some people, not work at all for others, or even cause harmful side effects in certain individuals. These genetic differences can influence how the body absorbs, processes, and eliminates a drug. This is one of the main reasons why some new drugs need to be studied even after they are approved for use. These later studies, known as Phase 4 or post-approval studies, help to identify any side effects or unusual drug responses that were not discovered during earlier clinical trials. This is because the initial trials may not include enough people or enough diversity to catch all possible reactions. Pharmacogenetics helps doctors understand and predict which drugs will work best for which patients, making treatments safer and more effective. When starting drug treatment, doctors usually follow the dose and timing recommended by the drug manufacturer, for example, 100 mg every 8 hours. However, people can respond differently to the same dose because of differences in how their bodies process the drug, which is also called the pharmacokinetics aspects of the drug, or how their genes affect the drug's action. If the drug doesn't work as expected, checking the amount of drug in the blood can help. A low blood level might mean the body is clearing the drug too quickly, while a normal level with no response might suggest the drug isn't working due to genetic factors. You can see in the figure, drug levels in the body can range from too low, or not effective, to too high, or possibly toxic. Some people respond well to low doses, while others need higher doses to feel better. Ideally, side effects only happen at higher doses, but for some powerful drugs, side effects can occur even at doses meant for treatment. Now, for the last slide of this video, let's try to answer the following questions based on our previous knowledge of the chapter. Question 1. Which is more closely related to drug response, the total drug dose administered, or the concentration of the drug in the body? And the answer is, the concentration of the drug in the body is more closely related to the drug response than the total dose given. This is because the same dose can lead to different drug levels in different people, depending on how their body absorbs, distributes, and eliminates the drug. The drug's effect depends on how much of it actually reaches the target site in the body. Now, time for question 2. Why do individualized dosing regimens need to be determined for some patients? And the answer is, individualized dosing regimens are needed for some patients because people can process and respond to drugs differently based on their genetics, age, weight, organ function, or other health conditions. A standard dose may be too strong for one person and too weak for another, so adjusting the dose helps achieve the best effect while avoiding side effects.